Assistant Professor from SMS College of Physiotherapy. So today I would like to share about tuberculosis, in colloquial term which is said to be as TB, as we all know. So definition. So these are all the synopsis we are going to see about tuberculosis today. So coming to the definition, so as we all know, tuberculosis is nothing but which is caused by Mycobacterium tuberculari. That affects the lung parenchyma and it may spread to other body parts like meninges, kidneys, bones and lymph nodes. And coming to the types of tuberculosis is further divided into 4 types. The first one is pulmonary tuberculosis, as we all know, that affects the lung. Whereas the second one is avian tuberculosis, that is caused by Mycobacterium avium of birds. Whereas the third one is bovine tuberculosis, that is Mycobacterium bovis, that is from the cattle and stuff, that is cow and all. And the fourth one is miliary tuberculosis, that affects the bloodstream of all body organs. And yeah, so what is the risk factor? Which people are more prone to tuberculosis? So coming to the risk factors, the first and primary stuff is the persons who are in close contact with TB patients. While the second one is immunocompromised people like who is elder people or the people with cancer. So such immunocompromised persons are more prone to get tuberculosis. The third one is drug abuse. So as we all know, sharing of drug needles and stuff will cause tuberculosis. And people lacking of adequate health care. So such people will also be more prone to TB. And pre-existing medical conditions and immigrants from countries with high incidence of TB also a risk factor. And certain occupations also plays a major role in developing TB. So that is all about risk factors. So coming to the pathophysiology. So let us consider, so initially a primary infection is happening. So the person is experiencing a primary infection with pulmonary tuberculosis. So the entry of microorganism through the droplet of an infected person is happening. So when the droplet is entering into our bloodstream or nasal or respiratory tract is happening, so the bacteria is traveling through the airways to the alveoli. So after that, the deposition of bacteria is happening in the alveoli, and after that, the multiplication of bacteria is happening in the lungs. So all these together, the bacilli are transported to the other parts of the body via the bloodstream, and phagocytosis by neutrophils and macrophages are all happening here. So that is all about the pathophysiology of tuberculosis. And coming to the clinical manifestations. So what are the clinical stuff that the patient will be experiencing once they got affected by the TB? So the first one is anorexia. The second one is low-grade fever, whereas night sweat. The patient will be experiencing heavy sweating especially during the night time, and fatigue. The patient will be experiencing very tiredness. Stuff will be happening, and weight loss. Since because of loss of appetite, the patient will be experiencing weight loss, and dyspnea, that is difficulty in breathing, will also be present, and non-resolving bronchopneumonia will also be happening, and where some people will be experiencing chest tightness, crushing kind of pain and all, and non-productive cough. Sometimes hemoptysis might also be happen, and mucopurulent sputum with hemoptysis, accompanied by hemoptysis will also happen, and inflammation and extrapulmonary symptoms include pain and inflammation stuff will be happening. So these are all the clinical manifestations that is experienced by the pulmonary tuberculosis patient. So coming to the diagnosis, so how will we conclude that a patient is having pulmonary tuberculosis? So the diagnosis would include, the first one is history collection. So initially when the patient is coming to the clinic or the hospital, we'll be collecting the history, so the traveling experience or the exposure to the TB patients. So the history will be collected. The second one is physical examination. So we'll be looking upon symptoms like clubbing of toes or fingers. So clubbing is present or not. The second one is swollen or tender lymph nodes in the lung. Will be inspecting that. And the third one is fluid around the lungs. That is pleural effusion is present or not. So unusual breath sounds like crackers will also be inspected. So in case if the TB is of miliary, so in case of miliary TB, we'll be looking for physical examinations like swollen liver and swollen lymph nodes, swollen spleen. So we'll be looking after it. And some tests may also be conducted like biopsy of the affected tissue. That's very rare, but still we'll be doing that. And bronchoscopy, CT, chest X-rays, and interferon gamma test. That is the golden test for TB. And sputum examinations and cultures will also be taken. And tuberculin skin test will also be conducted. So these will be diagnosis of tuberculosis. So once we concluded that the patient is having tuberculosis, so what is the management? So how will we manage the tuberculosis in patients? So the first is pharmacological. The first line drugs will be given. So the first line anti-tubercular medications will be given. That includes streptomycin, isoniazid, rifampicin, pyrazinamide and etembutol. So such drugs will be given in certain dosages and in certain days. So the second line medications would include capreomycin, ethionamide, cycloserine and vitamin B will also be given since they are immunocompromised. So vitamin D drugs will also be given, and third line drugs. So it includes 3 levels. First line, second line and third line. So the third line would include rifampicin, arginine, thiororacine and such drugs will be given. Yeah. So these were the compilation of tuberculosis. I hope it would help you. Thank you.